name is Mark Evans. I'm a consultant in diabetes in Cambridge, with particular interest in type 1 diabetes and pump therapy. I'm also a researcher in the University of Cambridge, so I'm an investigator on this grant award, which is looking at the artificial pancreas in adults.
My name's Kavita Kumareswaran and I'm a clinical research fellow currently working at the University of Cambridge, based at Addenbrooke's Hospital in Cambridge.
We have increasing numbers of patients with type 1 diabetes have been treated with insulin pumps in the UK. In our centre, for example, it's about 12 or 13% of folk. And while there's no doubt that used judiciously, it gives us a far more powerful and flexible way of delivering insulin and managing type 1 diabetes, there are still imperfections. And in particular, it still relies on people to be vigilant, to check their blood glucose regularly, and also the variability that some people find through no fault of their own from day to day means that people are still prone to highs and lows, particularly during the night. So the aim of this study was to try to link in a continuous glucose sensing device into an insulin pump so that we then created an artificial pancreas. And this work specifically was looking at whether we could run this overnight.
So there's sort of two aspects. One is sort of planning the studies, and the other side to it is actually doing a clinical study. So the planning involves a lot of sort of administrative duties, getting ethics approval obviously being one of the first steps, and then recruiting the subjects. But with what's probably more of interest is the actual study nights that the subjects attend for. And so with this particular study, we asked the subjects to arrive at the clinical research ward at Addenbrooke's Hospital at about 5:30 in the evening, so usually at the end of their work day. They would arrive, and then when we would switch them over to the study pump that we are using in the study. They would already have a continuous glucose monitor inserted the day prior that's already recording glucose values. They have a cannula inserted into their arm, which is used to draw the blood samples for glucose and insulin at regular intervals overnight. We gave them a standardised dinner meal at 7 p.m, and on one night they started the closed loop, which Dr. Evans has just described as basically the algorithm control using the continuous glucose sensor and the pump to drive the sort of insulin infusion rates overnight. And then on the other night they just have their usual pump regime overnight. And usually they do try to get some rest because we are drawing blood samples every 15 minutes, so it can be a little bit disruptive, but they do manage to get some sleep overnight, and then wake up in the morning. We're given breakfast at 8 a.m, and the samples for glucose and insulin continued until midday. At midday we completed the study, made sure their blood glucose were in reasonable range, and then they were discharged home. And then they came back to repeat this on a second night, sort of within 1 to 3 weeks. I completed the first first phase of the adult studies, which was looking at 12 subjects who came in and were tested on the closed loop system overnight in a dedicated clinical research ward. And we've also recently completed the second phase of the adult studies, which included a new group of 12 patients with type 1 diabetes. And this time they came into the clinical research facility, but along with their dinner meal they were also given a reasonable quantity of white wine with their meal, and that was sort of to challenge the closed loop and looking at the risk of hypoglycemia in the early hours of the morning, and And so that has just been completed, and we're sort of analysing those results currently.
This year we will be in a position so that people will be going home and testing these devices out, clearly under very carefully controlled trial circumstances, but really having these gizmos tested at home. And at the moment, because this is fantastically exciting, this is clearly the first time that anything like this has been done. So we're trying to figure out a lot of the bureaucracy and the setup and the sort of safety and the intellectual property and all of the other stuff behind the scenes. But this really will happen, and our hope and expectation is that we'll start those studies this year. Since the mid-90s, and I think this is the single most exciting piece of research I've ever been involved with. And it probably takes 2 sentences for people to cotton on to see just how exciting this is, to have a system which really can give people with type 1 diabetes better and safer control of their diabetes at home. And the hardware is there already, so we already have continuous glucose sensors that are out there, and we already have insulin pumps, so at least conceptually this is linking the two, and clearly there are major challenges involved with that, but at least the hardware is already there, so this is basically figuring out the best and safest way to get 2 pieces of existing equipment talking to one another. So I think this really will be something that really will come to fruition, will be out there soon, and really will help people with type 1 diabetes. Just a big thank you, and again, as I said, this really has been genuinely the most exciting bit of research that I've been involved with. I think it's been the easiest study we've ever recruited for. People been chewing our arms off to come in and help with these studies as a testimony to just what the exciting potential is for this work. So thank you to everybody who's helped support this work.